All right. Well, good afternoon, everybody. Thank you so much for joining our Wednesday lunch and learn today. I know we'll still have people hopping on within the next few minutes. We have many that register, and then that will go back and watch it later. They want to make sure they don't miss out on this great information. We appreciate Stephanie being with us again today. We're excited to learn about some more information when it comes to dental. We all know how huge dental is and how important it is to our clients and to our loved ones. And so any and all information that we get is very, very key and helpful. So we're going to just give a little brief intro of our presentation, then I'll introduce Stephanie and we'll get started. Get Fit Dental Head to Toe. It all starts with a healthy mouth. Explore how nutrition and exercise impacts oral health and, in turn, how a healthy mouth supports overall wellness. We're also going to discuss how diet choices strengthen teeth and gums and help prevent oral health issues, the link to hydration, saliva flow, and cavity prevention, how physical activity reduces stress and inflammation, including preventing gum disease. We're going to learn simple practical tips and habits or oral health habits that complement a healthy lifestyle. Stephanie is a registered dental hygienist and the community and external affairs liaison for Liberty Dental for the Liberty Dental Plan. Her role allows her to engage with the community and be a resource pertaining to dental prevention and awareness. She has been in various dental settings from community-based to scholastic settings. She has a bachelor's degree in health science and a certificate in medical business management. A highlight for her is being able to engage with patients to provide care and helping patients find the value in their oral health. Stephanie feels fortunate to be part of a team in which we advocate for the underserved and constantly searching for ways to bring inclusion to the forefront. Stephanie, thank you so much, and I'll let you take it away.
Thank you for that introduction, Dustin, and welcome everyone. Thank you for joining today's webinar. As a caregiver, parent, you're at the heartbeat of daily support for your children, your adult children, or your residents. So I hope today kind of serves as a reminder of why oral health isn't just about teeth, right? It's about the whole person from head to toe. So today's focus, as Dustin kind of briefly mentioned, and I changed a little things around, but I hope this webinar will equip you all with more knowledge and practical tools to support oral health for the individual with IDD you all care for. Today, we'll kind of examine the connection between our oral health and systemic, identify challenges, identify red flags, discuss the broader barriers within dental care system, while highlighting resources and strategies that can really help to bridge the gap. So let's start by talking about that it's so important to remember that our mouth is the gateway to our overall health, right? That bacteria in the mouth can enter the bloodstream, can contribute to heart disease, diabetes complications, respiratory infections, gum disease, and inflammations are not just so isolated, right? They affect our whole body. This is especially important for nonverbal individuals where signs of discomfort or infection may go unnoticed. Therefore, really understanding that poor oral health can contribute to serious health issues, right? As I said before, it can increase risk of heart disease. It can make diabetes even more difficult to control, and that can cause respiratory issues. So all those encompass that our oral health really is synonymous with our overall health or is health, right? And then I recently found a really good article via CareQuest in 2022, which shed some light on insight in regards to oral health disparities faced by individuals living with disabilities. And the findings were, I feel like, really eye-opening. Where households are experiencing those with disabilities report a much more higher rate of untreated tooth decay, missed dental visits, even emergency visits in regards to dental pain. And many also experience actually discrimination in healthcare settings and heightened dental anxiety. These numbers kind of emphasize the need for more inclusion in the system, more provider training, and even greater for navigating these challenges every day. And I think this just kind of explains why, early detection and support is so very much critical. So as you know, you guys are the caretakers and you guys are the, the first hands that gets them through that dental visit, which is always necessarily easy. It's not just about brushing and flossing, although that is very important and critical, especially, when clearing out the bacteria that sits on the teeth that can cause harm. Oral care for individuals with IDD involves so much more, right? There are sensory sensitivities. There's fear to the unknown. There's communication barriers, right? There are mobility issues. All play a role and a factor in making access to care just more difficult. So beyond access, how well are the individuals prepared for that visit? How are they supported, or how do they feel supported? How equipped are they, and the willingness of the provider to kind of meet them where they're at? So to me, acknowledging these challenges isn't necessarily about blame, it's about building kind of understanding, so we can move towards more of a, compassionate and empowering solutions for everyone involved. Now, I think it's also really important that we're watching for how oral health issues begin, right? So watch for warning signs or those red flags. Cavities certainly do not just happen overnight, right? So it's the plaque plus the sugar, and that byproduct is the acid that's created, and then it kind of attacks the tooth enamel or weakens the enamel, causing decay or cavities, right? And it's a slow progression, it's a slow process, but one we can stop through brushing, diet, reducing sugar intake, really increasing that water intake throughout the day, especially when you think about the IDD individual who may be on medications that are causing dry mouth or xerostomia. That water intake will really help to flush things out. Bleeding gums, bad breath, or changing in eating habits can signal pain or infection. Broken teeth or swelling are all dental emergencies to be made aware of. So as the caregiver, you're often the first to notice if something is wrong, right? So we want to make sure that we're mindful of taking like 30 seconds each day to do a quick oral scan, right? Looking for redness, looking for swelling, smells of unusual odors. And if that person communicate, you can always ask, do you have any pain or is there any issues? Because there's also body language as well. And these small actions can help to prevent major issues as well. Okay, and then as we know, many individuals with IDD are automatically referred to full sedation, and sometimes that's just for even a routine cleaning, but not every case actually requires that level of intervention long term. In fact, researchers support that the use of behavioral techniques like desensitization, like shaping, both rooted in like kind of gradual exposures, and reinforcement strategies are all effective, and alternative ways of providing care. And I think with the right approach and support from like behavioral specialists, many patients can learn to tolerate basic dental care in traditional settings. Um, and these strategies don't just reduce fear, right? They build familiarity, they build trust between the provider and the patient. And it really does bring, over time, long-term cooperation. And I think what's especially important is that uh, the approach is safer, right? Every time someone gets fully sedated that already has a cognitive risk, especially for those with already, navigating through neurological and developmental challenges, um, you know, finding ways to transition them to off of sedation and more so being able to successful in-office visit over time is also something to look at and consider. So now I'll just have you guys take a quick look at this video. We troubleshooted to make sure that the audio worked, so I'm just gonna play that.
In this video, you will see a caregiver without eye protection brushing her brother's teeth. If you are a professional caregiver, it is highly recommended that you use eye protection while brushing the teeth of the person you support. Let's look at some behavior supports you can use to help the person you support overcome fear, resistance, or disruptive behaviors during daily mouth care sessions. In this video, we are going to cover desensitization and shaping. Desensitization is the process of breaking down a large task into small, incremental steps. This allows the person you support to adjust to something new or different. They will get to use the new sensations and build skills to complete a task. Let's look at an example of how to use desensitization. If the person you support resists having their mouth examined, you can use desensitization to build their tolerance. The first step can be as small as the person holding their mouth open and looking at it in the mirror. Gradually, you will introduce small steps that build towards the goal. Next steps might be touching their own mouth, then letting you look into their mouth, then letting you touch their mouth for a few seconds. Eventually, they will work up to tolerating a quick mouth exam during daily mouth care sessions. Desensitization can also be used to break an overwhelming task down into small, manageable steps. This helps a person build skills and confidence. Shaping uses the same process as desensitization, but includes offering incentives to motivate the person to reach a goal. Let's look at an example of shaping. You will start with a task like brushing teeth and break it down into small steps. Then choose an incentive to offer when the person completes a step. If the first step is putting toothpaste on a toothbrush, you could offer praise as an incentive. You could say, "I love how you were so careful when you squeezed the toothpaste. It is all on the toothbrush and now we don't have to wipe any off the counter." Make sure to offer incentives that are appropriate for the person you support. Incentives need to be motivating as well as healthy. Don't choose a treat like candy that harms teeth. At first, the person you support will be offered an incentive every time they complete a step. Slowly, you will start to increase the expectation of how many steps they need to complete. Eventually, the person you support will need to complete the entire task before being offered the incentive. Once they have mastered the task, start reducing how often the incentive is offered. Eventually, the person will not need to be offered an incentive. Instead, the feeling of ownership and accomplishment for completing the task will be their motivation.
All right, so that was just an example as to modifications that can be made, especially if that task is already difficult for that resident or for that adult child. So when it comes to oral health, right, small daily habits truly make a big difference, especially for individuals with IDD, where routine and predictability really do go a long way. Start with what's manageable, right? Brushing twice a day is your best defense against cavities, and cutting back on sugary or sticky snacks also help. Try to connect brushing with something familiar to them, right? Like after breakfast or before their favorite show or activity. Oftentimes, tying in oral care to an already established habit can build consistency without a struggle or less of a struggle, right? Remember, it's not to have it perfect. It just needs to be consistent, right? And that's where you really see the impact. So now here's a short video that kind of reinforces safe, effective brushing and provides you with techniques on positioning, your pace, tools that can make brushing easier as well. Okay,
In this video, we are going to review 3 different positions you can use while cleaning someone else's teeth. In the first position, the person you support can sit in a chair or a wheelchair if they use one. You will stand next to and slightly in front of them to clean teeth. Always make sure to lock the wheels of the wheelchair. In the second position, you will sit on a couch or chair while the person you support sits on the floor in front of you. Have them lean back against your knees while you clean their teeth. As an alternative, you can also kneel on the floor with a pillow on your lap. The person you support will sit in front of you and then lie back, resting their head and shoulders on the pillow. Professional caregivers should always check with the company policies before using new positioning. In the third position, you can clean a person's teeth while they lie down on a couch or bed. While you are sitting on the couch or the edge of the bed, have the person you support rest their head on the pillow in your lap. Use one arm to provide extra support to their head or shoulders if needed. Mouth rests are a tool you can use when the person you support has trouble holding their mouth open. When using a mouth rest, make sure to remove it every 60 seconds so the person can swallow and rest their jaw. As a caregiver, you might need to try different positions to find the one that is most effective. You want to balance keeping the person you support comfortable while also effectively cleaning their teeth.
All right, and now we'll kind of discuss those barriers that I had mentioned before. So even with the strongest daily routine, right, many families and caregivers still struggle to access appropriate dental care for their loved ones, especially when there are so few providers who both kind of accept Medicaid and also are trained to care for those with IDD. And I know many of you have faced kind of long wait times, limited sedation options, or burdens with regards to traveling so far to get care. But these barriers, are obviously real and frustrating. And that's completely valid, right? And while there is no necessarily a quick fix, I wanted to kind of share some resources that are available and letting you know that they're kind of expanding provider training and support. So I'm not sure how many of you all were on the call when it was Dr. Garvey, Dr. Bridges, along with Whitney Haley. And they actually are doing a training session for providers along with their staff, so their assistants and hygienists. Well, they'll get like hands-on training and support to care for the IDD population. And it looks like they have a tentative date for end of July, end of August, depending on obviously contractual execution. But, that's kind of like on the horizon and what they're thinking about as far as being able to train more providers that are being able to care for this patient population. So I just wanted to share that with you all. And then resources you can kind of utilize today. So all the videos I had shared are through Access for All Smiles. It's a really great platform where you can get a rich toolkit of tips, videos, caregiver guides, free to completely download. And then depending on obviously who your healthcare provider is, whether that be Liberty, DentaQuest, or whomever you have, they have these platforms where you can find a dentist toolbox or tool portal to actually find providers in your area, but also leaning in to make sure that you're coordinating this with your actual dental provider, and then they kind of take the next steps in regards to contacting our member services, or you can as well, and then decide if this is necessarily an issue or concern where they escalate it to something called our customer care unit. There is also a mobile outreach program through UF as well, through the Arc of Alachua, where they do offer screenings and prevention focused on particularly for adults with special needs as well. There is Feel Good Dentistry that's in Miami, and they use a Medicaid waiver that assists with care support. And then there is also Special Day Foundation that I was also on the call, which is a really great program. There are 3 locations, one in St. Pete, one in Hialeah, and one in Naples, where they offer their advanced education general dentistry program. The residents see those with IDD. And I think how it works is they utilize whatever funds they have from the insurance provider themselves, and then whatever's not covered, they take it out of the foundation. But what I really like about this program as well is that the hygienist herself will come to the ADT home center and provide care, like oral hygiene instructions, get the actual resident geared up for that appointment, as well as they do in-house training for all the caregivers as well to reinforce home care. to make practical changes and tips that you can utilize on a daily basis. And then in clinic, when they're seen, they have the option of sedation on site, oral, IV, and general anesthesia through a hospital setting. However, St. Pete and Hialeah are just for adults, whereas Naples is strictly for children. They have a whole sensory room. It's a really great program. So if you all are not familiar with it, then definitely feel free to reach out to them because I think that's a great resource. I wish we had that in every county. And then as far as final thoughts go, as we wrap up, I just want to reiterate that oral health is really a key part in our whole body wellness, right? And caregivers, parents are all critical in the role of the front lines, to that daily support. So taking small, consistent steps, using available resources, sharing those resources, will help to create a healthier outcomes, right? And communities as a whole. Um, and I really do thank you all for all that you do. So thank you.
Thank you, Stephanie. I thought it was cool when you talked about, working, brushing. It can be a struggle. I understand for our
Okay.
clients.
Mhm.
I've worked as a DSP before.
Mhm.
So I understand some of the struggles when it comes to hygiene and things like that. But when working it into a routine, like, it's before you brush or after snack time or before snack
Mhm.
time or before a movie or before,
Yeah.
something that they want to do, motivate them a little bit and put it into their routine is something they're already doing.
Right, right.
I
I
like
always say my analogy is like you have to do the things you need to do in order to do the things you want to do. So,
exactly. Yeah, I
right?
try to tell my son the same thing. I'm like, you have to eat good food if you want some sugar. Like,
Right. You
yeah,
got to earn it.
yes, yes. So anybody else, if you want to click the little emoji to raise your hand or type questions in the chat, or if you have any questions or any thoughts for Stephanie, please don't be shy. Now is the time to let those questions loose. And if we don't have any questions, that's okay. No pressure. I mean, it's a short and sweet meeting, but it's all right. It's a lot of great information from Stephanie. As always, I already put in the message or in the chat to start us off today that we will send out resources and the recorded meeting from today. We'll send that out in the morning, as always. And then if you would like a certificate of attendance for this meeting, you can email me, Dustin@arcflorida.org. Email me individually, and I'll send you a certificate of attendance. Just quick reminder: they are not CEUs. We're not accredited to officially give out CEUs. They are just certificate of attendance papers. So again, we appreciate you all. Please, please, please don't hesitate if you have a few questions before we head out. Just let us know. You have anything to add, Dina? You're muted. Sorry. You're still muted. Sorry. Nope. Hey, Dina, you're still muted. There you go.
All right.
You're muted this whole time.
I'm just talking away. So no, nothing in the chat. We thank Stephanie for a lot of good information, and we'll be sending out a copy of the presentation and on our YouTube channel. So we appreciate everyone joining.
Thank you.
Anything you want to add, Stephanie?
No, I mean, if anybody needs to reach out to me, they can. I mean, I'll have that in my PowerPoint presentation if they have any questions.
Perfect. All right. Well, thank you so much, and we
Thank you.
appreciate you all. Y'all have a great rest of the week, and happy Wednesday.
Happy Wednesday.